And we're live. Over the past few weeks, COVID-19 infections in India have risen steeply, leaving in its relentless wake hospitals at capacity, ICU rooms and beds filled up, ambulances not available, doctors and nurses and healthcare staff exhausted. In fact, I was reading today that one of the doctors in Delhi committed suicide. Vaccine supplies diminishing, medicine supplies dwindling, crematoriums and burial grounds are running out of space. The magnitude of death and destruction is staggering. But as the health infrastructure in the country crumbles, it has also given a rise to unsung heroes, the regular folk, who are doing everything that they can to help their countrymen and women survive this tragedy. My guest today is Gurpreet Wasi, who, along with her team in India, is working on ground in New Delhi currently to connect resources like medicines and oxygen cylinders to people who need them. To tell you a little bit about Gurpreet, after 3 decades of working as a marketing and communication professional, she quit corporate life in 2016 to create a social impact platform called Race Supersikh Run, a marathon event inspired by Sikhi and Sewa. Since then, she has actively volunteered with Khalsa Aid and is a part of their core team in India. She also runs the Super Sikh Foundation, a registered trust that works on the mandate of social welfare, justice, and empowerment of vulnerable communities. Please welcome Gurpreet Wasi. Hi, friend.
Hi, Roop. Thank you for having me
Thank you.
here.
Thank you so much. I know it's really early there in the morning, and yeah, you woke up for me. Really appreciate it. And it is Sunday morning.
Yes. No, I'm glad you made me wake up, and I'm very happy to be here. Thank you very much, Roop.
Can you tell me what the situation is like on the ground? Of course, we read it on all social media. We read it on Twitter, and big media houses are giving us our information, everything that I mentioned in the intro. But tell me, what do you see on ground? What do you see in Delhi when you go out and work in the communities there?
It's beyond explanation. I mean, it's devastating. Every day, I think it's a struggle to, when I wake up in the morning and at that second that you wake up, you realize that your day has begun, and your day. I just feel scared to open my phone. We are networking just now through a whole lot of other organizations on WhatsApp, and the minute you open your phone, it is people begging for hospitals, for oxygen, for help, for just everything, and people losing family. I don't know a single friend or relative just now who's not lost family members, and it's not one family member, it's multiple family members. People's entire families are getting wiped away, so it's just beyond devastating. There could be nothing worse that I think our generation has seen.
And how are kids coping with it? I know you have a young daughter and you have a son as well. How are they coping with everything?
So I think it's with the children. It's been they've not gone to school now for the second year. My daughter's college opened briefly for 2 weeks, and she was just out of school, joining university. So it is for them a complete a bleak future. She was supposed to go to the US to study. That got cancelled. Then got admission here, and my son, who's not gone to school now for 2 years. So for them, it's I think it becomes very difficult for the parents, because you try to keep hope alive. Things are going to get better. School's going to open in 2 months. You're going to be back. You're going to be back with your friends. And so it is that after a while, I think it's now started getting on to me that you probably keeping a lie alive. I don't think schools, universities opening for maybe another year or maybe more than that. So I think they're coping well. I find that sometimes when you're down in the dumps, it's them who probably, because they can believe a lot more things that as adults we can. So I think in my house, it's the reverse thing that, I find that they bring in a lot of positivity and help me cope up and keep doing stuff.
A few months ago, when the farmers' protests were quite active in New Delhi, in that area, you were volunteering during that time as well. I remember thinking at that time, because no one was wearing a mask in the protests. Like there were a few people who were wearing masks, but majority of people not wearing masks. And around the same time, there were weddings. India was open, and whatever we saw on social media, people wore masks, but it was very casually worn. It was not something that people were really worried about or taking too much precautions. That has obviously changed now. But why do you think people took it so easy?
I think nobody saw it coming, and I do remember, because when at the farmers' protest, I had the mandate that I had was to talk about the protest because the media was blocking it. So therefore, at that time, I was posting a whole lot of pictures, and I do remember your commenting, a lot of other people commenting about not wearing masks, etc. And at that time, it just seemed that there was an alternative story or narrative, especially in Punjab. And I was in Punjab, say 2 weeks ago, and where they were that it is a government inspired false propaganda. There is no corona, and because the farmers at the protest are not affected, and there are thousands of them together. So how do you justify that only in the cities this is happening and it's not happening in the villages in Punjab? And look, we are safe. And there was this whole bravado around it, and somehow you tend to think about it, saying that why is it that they've been here and they've been here since the outbreak of corona, and you didn't see really anything happen there. So and I remember making masks, and they would just outrightly reject, saying that we don't want to wear this. And I try to find out, and they said that because you wear a turban, and especially in the villages in Punjab, the turban is a double-sized turban, so it's a big turban. So what you do is, how do you put on a mask? Your ears are inside your turban. So we got these masks made specially with tassels, so that they can tie it around their turbans. And I remember going and giving those, and they would keep that. But there was this whole thing about there's also practical difficulty, which doesn't justify in any way not wearing a mask. But it was that they weren't really convinced that there was a disease, and it was probably that we had seen in India that the CEA protest had been completely wiped off because of corona, and they thought that probably this whole fear mongering is because they want everybody to go away from there. So all of it put together, the politics of the country, where your leaders and the governing parties saying that we've won over corona, we probably reached herd immunity. There were election rallies happening, there were festivals being celebrated. So I think all of it cumulatively, I think something really foolish. I think as a country, we just tend to trudge along, saying that everything looks okay, when there are no restrictions on large gatherings, when all of these festivals can be celebrated, political campaigning can happen. Probably that we just reached a plateau, and we're safe. I think that's what was happening.
Okay, my mic was muted. Sorry. Yeah, I think, of course, it is the responsibility of the government, of the public health, to repeatedly bring forth these messages. Yeah. We are struggling with that here in Canada as well. In Alberta, currently, we're leading the infection rate in Canada. In fact, this morning I was reading news that in Calgary, where I live, the infection rate is twice the infection rate of India.
Really?
It's just that we're lucky. Yeah, it's just that we're lucky. We're not very heavily populated. We're not densely populated. So you're not seeing that number of people in the hospital as you would in India. So you just do the math, right? Like if 2% of our population of 38 million is infected compared to 2% of India, of course, India is going to have a much larger population in the hospitals. And our health system is, of course, able to handle that 2% that is going to get sick here, as opposed to Indian health system, which is crumbling right now, unfortunately. So those comparisons, when you make them in terms of we're very lucky, we're very privileged because of the lack of population, but the disease is equally vicious wherever you go. It's unfortunate. So talking about health infrastructure, is it getting better, or is it equally as bad as it was, let's say, 2 weeks ago or a week ago?
So I think the when you say health system crumbling, it is all, I think, more than health system crumbling, because this is the situation that has been in India for years. It's not like privatization has not helped. The common man has not been able to access medical help even pre-corona. It is the administrative failure. It is that we got 1 year to prepare ourselves. And I was reading that 1 year on 1st of April last year, the health ministry had flagged the lack of oxygen, saying they had predicted that we are going to run out of oxygen. And at that time, nothing was done. I think there was like complete non-acceptance of the fact that what we were heading to. So currently what has happened is that we didn't, because there was last year when the first wave came, we had built some infrastructure. There were large public areas which were converted into makeshift hospitals, etc. They disappeared. So all that public money that was invested in making those, there's two, now it is, the time is not right to ask those questions, but somebody will, saying that what happened to the infrastructure that was created. So now the problem is that we're recreating everything. And as you must be reading, the gurdwaras are stepping in. There is a very large gurdwara, Rakabganj Sahib, where they have the largest wedding hall facility over there has been now converted into a 500-bed facility where they are putting up oxygen support, etc. So all this, I think we had ample time to do it, and because of this administrative laxity, it was not done. The private hospitals are now tying up with hotels wherever they can to put up facilities, but I think the numbers are just too huge, and nobody just can't cope up. The government really has to step up and see that all government schools, colleges, wherever there are public spaces, need to be quickly turned into COVID facilities. I think they're just moving too slow even now.
So it hasn't really improved by any means, because I keep hearing from different people, oh, things are going to get better within a week. The numbers are going to come down.
No, it is because, they have now finally agreed, stepped down from their big egos and finally accepted they need external help. So it is only now last week that they said that they're waiving off duties on, oxygen support things, the concentrators, etc. So now, like with Khalsa Aid, the first cargo shipment from UK with concentrators is arriving today, and while it should have arrived probably 10 days ago. So therefore that's they're just now waking up, saying, and every country in the world has offered to help India. So I think the best thing they can do just now, the government can do, is to just accept help, and help should pour in. And we are also reading that the government wants it all routed through. So there is still red tape happening, rather than saying that let's just get on to help and work through private organizations, the Red Cross, etc., and reach our villages. Because, Roop, we are still safe in the cities. We still have hospitals. There is a hospital probably every 2 kilometers, 3 kilometers. But I have friends who moved to, say, Himachal, etc., to escape the crowd of the city, saying we are safe. And I got a call from a friend who'd gone to Himachal, saying in Kangra there are only 2 hospitals, and there are 2 government hospitals, no private hospitals, and there are people there. It's reached villages, but there are still hospitals, but there are no hospitals there. So what's going to happen in the villages is unimaginable. And our media doesn't really talk about it. So I don't even know whether we're going to hear a lot of what is happening in our villages. We still can report through Facebook, or I don't know, till Facebook or till the social media allows us to talk. We still reach, our stories still reach people, but stories from the Indian villages may not even reach the world.
Exactly. We hear everything from Bombay. We hear stuff from Bangalore. We hear from Delhi. But of course, we won't hear where technology hasn't yet reached, or social media hasn't yet reached. And COVID has proven to us over the last year or more now that it is not something that can be handled in isolation. So it is a problem of the global community. So if other countries are coming to help, they're not just doing it as out of charity or pity to India. They're doing it because they're trying to protect themselves too. So nobody is safe until everybody in the world is safe. So
Absolutely.
Yeah, that's the way I think we all of us need to start seeing that. So if India is hurting right now, Canada could be hurting tomorrow. Italy hurted, US hurt really badly as well, right? So we all need to take care of each other. This is the time where all the countries need to hold their hands together, put their heads together, and get past this challenge. How are you helping now on ground? I know that you are volunteering with Khalsa Aid. They are getting the oxygen cylinders in today. The shipment's coming in. I also see some videos of some Sikh youth. They have oxygen cylinders in their cars where people can come in and get oxygen. It's like a drive-through, oxygen drive-through.
Yes.
And then there's lungers as well. So how is the community? Let's forget about the government for a second. Let's forget about the hospitals. How are people coming together to help and support each other?
Yeah, so I think it's been going on now for a long time that whenever there is a situation like this, whether it is the Delhi riots, whether it's the farmers' protests, etc., there is a community, and it's the same people. I notice it's the same people who come up, and I think at this time the Sikh community, like always, I think is at the forefront of it, and I think we are more visible. I think we just probably rise up to the occasion faster because there is precedent that in place. Our gurdwaras have been doing and been opening up to people for a long time. So I think there's one gurdwara in Indirapuram in Delhi which started the langar concept of oxygen, where people could just drive in their cars, and then other gurdwaras picked it up. The people who are doing it through their cars, etc. But it is not just the Sikh community. I see a large number of Muslim organizations, etc. also stepped in, and I think what and there are so many others. There are even it is beyond religion just now. It is that there are various kind of people who don't get either highlighted or talked about, who and like I told you that we have a WhatsApp community where we are connected, where one group is probably trying to get hospital admissions, one group is trying to verify whether the leads that are being circulated for oxygen and hospitals, etc., are correct. Well, there is another group that recently we realized that there are expectant mothers, women in special, are very vulnerable. People, pregnant women who've got COVID, not getting admitted. You're risking two lives. So there is a community of people who are only helping those women, children. So at the moment, I think the common citizen, I think, is really the hero, and everybody is rallying with each other and trying to make the best of the situation.
Yeah, it's amazing the kind of organizing that's happening on Twitter and social media, and just normal folk are able to do it, and yet the government is somehow failing there.
Yes,
So
yes.
it's intriguing.
It's intriguing, and when one is failing when you try and you fail, and one is to say we don't accept. You've the chief minister of UP, and the largest affected state and the largest state in the country, is saying that if anybody comes up on social media and asks for help, you'll be jailed. And there is a boy who asked for help for his parents on Facebook, and he was charged. And he's telling hospitals that if you raise any red flags about oxygen not being supplied, I'm going to, your license is going to be cancelled. So I think this government needs to be charged for crimes against humanity. Even when the entire world is trying to help, to sit over here and say, okay, if you're going to ask for help, you're going to be charged. I mean, you don't provide help, and then if you say you ask for help, you're going to be. It's just. I mean, there's no words to express that. Where do they come from? Where does it come from? I think they're a very image-conscious government, and I think if you see, even the international PR machinery is all working towards, okay, how do we counter whatever is happening? If there is information being published about what's happening in the country or the government's failure, then we should all rise up and say that and do some good PR. So all you're reacting to is how to manage to save your image, rather than trying to spend that time to figure out solutions in the country.
If someone like me in Canada wants to help, how do we help? What is the because of course there's multiple organizations fundraising, and they're trying to send oxygen cylinders to India. But you're working in India, you're working in ground, you're trying to connect people with oxygen to people who need it the most. What do you think I should do to help those people?
So I think, Roop, the very fact that you're doing this program and you're highlighting, I think this is the biggest thing that anybody sitting in your position could do, and you're doing that. So just a second. Sorry, Roop.
No worries.
Yeah, so the phones start coming in. Yeah, so I think the in when there is lack of Indian media, or which is supposed to highlight the situation, when they are not taking up their responsibility, I think the biggest responsibility anybody sitting abroad could do is to highlight it. And for a government that is as image conscious as the one that we have over here, if the international community highlights what's happening, and I think that really puts pressure, because there is a lot of pressure that people sitting outside can put on the government just by talking about it and highlighting and amplifying the situation in the country. And the second thing is that there is a lot that one can do, where I see a lot of friends who started doing, is that sitting abroad, if they here we are in the middle of whirlpool. Every day in the morning you get sucked into trying to firefight situations, hospital beds, somebody needs to be just rescued. There are children who've got, like, both the parents are unwell, and there is a 14-year in the house. So what does he do? So because we are micromanaging this over here, then people sitting in Canada or anywhere else in the world, I think what they could do is that if they could figure out how do we manage data in India, if there could be a way that technology could suggest about how to get this whole information consolidated, all these organizations working all over the country in various cities. If this data can be organized, somebody could do verifications, if somebody could just give us solutions, figuring out how can one provide help at a micro level. I think somebody who can sit back and look at the situation, all the information, and cull out important information and pass it on. I think that is the biggest service that one can do, because we are just facing too much overload here every day to help in a meaningful way. At the end of the day, every day I'm asking myself, could I have done it better? But there is no time, there is not a single hour in the day that you can sit back and plan. So I think those are the things beyond, obviously, fundraising, which I think is happening. But there is still a lot more that one can do with information and provision of the.
How can they contact you, or how can they start working on that? So let's say help with the data. How can we do that? Who do we talk to? Where do we start?
So because I think what I could be is a wire media. I am connected to 3-4 very large communities on WhatsApp, and what I could do is that there is another foundation that I'm a part of, which is the Super Sikh Foundation, which I told you about. So if you could highlight the email ID supersikhfoundation@gmail.com, and if there is somebody who could volunteer their time, maybe even 2 hours a day or a week or whatever time, then at least if we have that information, we can pass on. Say if I have a lead of oxygen suppliers or concentrator suppliers, somebody could just negotiate, talk to them, figure out if the specs are right, etc. Or supply of oxygen cylinder, if we have data of all those people, then somebody could just sift through it, write emails, figure out availability. I think that saves a lot of time, that then that information can be provided, and we could help people.
Oh, that's fantastic. I didn't even think of that. So I think I'll look up volunteers. I'll see if I can send people your way, or maybe I'll volunteer my time as well. So I understand that admin takes a lot of time when you're trying to send emails back and you're trying to just get the data sorted. Well, thank you for that. I think that'll be amazing. Well, thank you so much for your time. I don't want to take more of your time. I know you're getting phone calls now, and you've got much more important things to do. Really appreciate it. So I will get that information out as much as I can, and hopefully we'll try to help you every way we can.
You stay safe, and hope to see you sometime soon. Thank you very much.
Yes. Sooner than 14 years.
Yes.
It's been a long time. All right. Take care. Bye, Gurpreet.
Bye. Bye, Roop.